Hello, everyone. Here's some advice from an orthopedic specialist with years of experience working in Europe. My role today is to help you understand the potential causes of shoulder pain and provide self-assessment tests to evaluate your condition. The shoulder is an incredibly important joint, enabling us to perform complex movements, from lifting heavy objects, pulling, and pushing, to delicate actions like writing or drawing. When shoulder pain occurs, your quality of life can be significantly affected. Instead of feeling helpless or worried, let's start with a few simple assessments. I will guide you through 10 self-assessment tests to help you identify potential issues with your shoulder. This information will not only give you a better understanding of your condition, but will also serve as a valuable resource when discussing your symptoms with a doctor, if necessary. Get ready, and let's explore together the role of self-assessment and when to see a doctor. Self-assessment is an essential step in understanding the potential causes of shoulder pain. Simple tests can help identify the problem without the need for special equipment. However, this is not a substitute for medical consultation. If you experience persistent pain, numbness, or worsening muscle weakness, it's important to see a doctor. Symptoms such as widespread tingling, numbness, or a deformed shoulder could indicate a more serious issue. Always document your symptoms when they occur and the intensity of the pain to assist your doctor in making an accurate diagnosis. Cause 1. Pinched nerve in the neck, symptoms, and self-test. One common cause of shoulder pain is a pinched nerve in the neck. This can occur when the nerve is compressed due to a herniated disc, bone spurs, or prolonged poor posture. Symptoms include pain radiating from the neck to the shoulder, arm, and even down to the fingers. You may also experience numbness or tingling in these areas. To perform a self-check, follow these steps. Sit upright and turn your head toward the side where you feel pain. Gently tilt your neck backward. Use your hand or ask someone to apply light pressure on the top of your head. If this movement reproduces the pain or numbness, it may indicate a pinched nerve in the neck. Perform this test carefully and stop immediately if the pain worsens. Cause 2. Thoracic outlet syndrome. Symptoms and Roos test. Thoracic outlet syndrome occurs when blood vessels or nerves in the space between the collarbone, ribs, and muscles are compressed. This can lead to shoulder pain, arm weakness, or a tingling sensation in the hands. A common symptom is heaviness or increased pain when raising your arms. To check for this condition, perform the Roos test as follows. Stand or sit upright and raise both arms to shoulder height, 90 degrees, keeping your elbows bent. Slowly open and close your fingers for 3 minutes or until discomfort arises. Observe if pain, numbness, or fatigue occurs during the test. This test helps determine if the thoracic outlet is restricted. If symptoms appear within 20 to 30 seconds, take note and consider consulting a doctor for a more detailed evaluation. Cause 3. Rotator cuff tear, symptoms, and strength test. A rotator cuff tear often occurs when the muscles around the shoulder are damaged, leading to pain or limited movement. A common sign is the inability to lift the shoulder or noticeable weakness when raising the arm. To check for this condition, try this simple test. Extend your arm forward at about a 30-degree angle outward. Rotate your thumb downward so it points toward the ground. Ask someone to apply light pressure to your arm or press against your own resistance. If you experience weakness or pain, it may indicate a rotator cuff tear. Be sure to compare the strength and range of motion between both shoulders to identify abnormalities. Cause 4. Shoulder arthritis, symptoms and range of motion test. Shoulder arthritis typically occurs when the cartilage between the joints wears down, leading to pain, swelling, or clicking sounds during movement. This condition is common in older adults or individuals who frequently use their shoulders. A key sign of arthritis is limited range of motion, especially during external rotation of the shoulder. To test for this, follow these steps. Bend your elbows to a 90-degree angle and position your hands in front of your chest. Rotate your forearms outward, keeping your elbows at your sides. Compare the range of motion between both shoulders. If one shoulder cannot rotate outward or causes pain during rotation, it may indicate arthritis. Pay attention to symptoms such as clicking sounds or stiffness during movement. Cause 5. AC joint injury, symptoms and test. The AC, acromioclavicular, joint connects the collarbone to the shoulder blade. Injuries to this joint often occur due to falls, direct impact on the shoulder, or overloading during weightlifting exercises like bench presses. Symptoms include sharp pain in the AC joint, discomfort when moving the arm across the chest, or pain while lifting heavy objects. To check for an AC joint injury, perform the crossover test. Pull your arm across your chest. Observe if there is sharp pain in the AC joint during the movement. You can also test by applying upward resistance under the hand or by stretching both arms outward. These tests can help identify inflammation or damage in the AC joint. If pain persists or worsens, consider consulting a doctor for further evaluation. Cause 6. Bursitis, symptoms and how to test. Bursitis occurs when the bursa, a fluid-filled sac between bones, tendons, and muscles, becomes inflamed. This condition helps reduce friction during movement, but when inflamed, it causes localized shoulder pain, swelling, and warmth upon touch. Bursitis may also occur alongside tendinitis. Symptoms are usually focused on a specific area and do not radiate down the arm. To check for bursitis, follow these steps. Extend your arm backward and apply light pressure to the painful area. Observe if the pain becomes more pronounced or if the swelling increases. Bursitis often results from overuse of the shoulder or direct trauma. If symptoms persist or worsen, consult a healthcare provider for proper diagnosis and treatment. Cause 7. Impingement syndrome, symptoms and test. Impingement syndrome occurs when the shoulder is positioned forward, leading to compression of the tendons within the shoulder joint. Common symptoms include pain when moving the arm through a specific range of motion, known as the painful arc. To check for impingement, follow these steps. Keep one arm steady alongside your body. Use the opposite hand to assist in lifting the elbow of the affected arm. Observe if you feel sharp pain or a sense of tendon compression as the elbow is raised. This condition is common and, if untreated, may lead to tendinitis or tendon tears. Test both shoulders to compare any differences in pain or range of motion. If symptoms persist, consult a healthcare professional for further evaluation and treatment. Cause 8. Shoulder instability, symptoms, and apprehension test. Shoulder instability often occurs in individuals with hyperflexible joints or those who have sustained a shoulder injury. Symptoms include a sensation of looseness, the shoulder feeling like it may slip out of place, or even frequent dislocations. To perform the apprehension test, follow these steps. Position the affected arm so that it is bent at a 90-degree angle and extended backward. Ask someone to gently push your arm further back while you hold this position. Observe if you feel discomfort, anxiety, or fear that the shoulder might dislocate. This reaction may indicate shoulder instability. Perform the test gently to avoid further injury. If instability interferes with daily activities or causes significant pain, consult a healthcare provider for assessment and treatment. Cause 9. Fibromyalgia, symptoms and characteristics. Fibromyalgia is a chronic condition that often causes widespread pain and prolonged fatigue. Unlike other causes of shoulder pain, fibromyalgia typically involves symptoms in multiple areas of the body, not just the shoulder. Common symptoms include muscle pain and tenderness, stiffness in joints, particularly in the morning, fatigue that persists even after adequate rest, difficulty sleeping or unrefreshing sleep. Specific tender points may be found on the shoulders, neck, and back. To identify fibromyalgia, check if you experience pain in multiple areas of the body or persistent fatigue despite rest. Because this condition can be challenging to diagnose, it's important to consult a doctor if you suspect fibromyalgia for a more thorough evaluation. Take care of your shoulders today. Shoulder pain not only causes discomfort, but also significantly impacts your quality of life. The simple tests we've introduced can help you identify potential issues and take the right steps for proper care. If the pain persists, radiates, or interferes with daily activities, seek help from a doctor or physical therapist promptly. Don't let shoulder pain hold you back from enjoying life. Share this video with your family and friends so they too can take better care of their shoulder health. Subscribe to our channel for more helpful videos, including exercises to improve shoulder function and tips for a healthy lifestyle. Together, we can start improving our health today.